Welcome to The Kick, your expert-led podcast helping you explore and learn everything about getting pregnant, pregnancy, birth and becoming a parent.
On the podcast and our online pregnancy program, Grow My Baby, we share my experience of helping more than 4,000 babies to be born.
And our experience of running a women's health clinic and parenting 4 boys.
We're here to help everyone to feel empowered in pregnancy and birth with real-life practical information.
Welcome everyone, I'm Brigid Maloney.
And I'm obstetrician Dr. Patrick Maloney.
And welcome to another Q&A session. And we're really excited to be here, Patty, aren't we?
I'm jumping up and down over here because I like Q&As.
Yeah, like Q&As. And I want to start, nothing like getting straight to it, but I do want to start with someone that has sent in a written one. Now, we normally don't do written ones, do we?
Well, we like the voice.
We do like the voice.
Because then we can hear your voice.
Yes. However, this is from one of our people doing the program.
Oh, good.
Yep. So she gets priority, which we keep telling people. So it's, hi, Dr. Pat and Brigid. I love your podcast and the Grow My Baby course. Thank you, guys. I also love making fresh fruit and veg cold pressed juices. I'm 26 weeks pregnant. I've had 2 juices made at home in this time, and I've read that it's actually not safe to have these. Can they be safe if the produce is washed, cleaned, and what additional steps would I need to take to make sure a freshly prepared juice is okay? To me, it seems the same as having a fresh salad at home. Do I need to sterilise my juices? Would love to know your thoughts. Thanks.
Wow.
I know. That's someone that's read something on the internet, isn't it?
I think so, because I think the concern from people comes, really about how their food is prepared if they have it out. Mm. But in your house, if you've been, if you haven't killed yourself yet from the things that you eat, if you haven't poisoned yourself yet from the things that you eat, then I think that, it's very safe to follow those big pregnancy guidelines that we give people about eating. But fresh fruit and vegetables sounds terrific.
And what do you think she is worried about?
Well, I think people are concerned that if they had a juice made somewhere in a juice shop, that it might have been prepared incorrectly and that they might be exposed to things like salmonella or E. coli. But again, we should be able to trust the businesses that we go to that they'll serve food that is safe. And in particular at home, our usual careful food handling practices at home are going to keep us safe from those things anyway. Mm.
We had a podcast a little while ago with Gary Kennedy, Safe Foods in Pregnancy, and it's probably time we do another one, but he did say that if you're out and about, some of the fast food chains, they have such strict policies and guidelines. I mean, they bleach everything.
So, maybe, and so, that's right. So he did say that if you are in an unfamiliar place and it's lunchtime and you're hungry and you really don't know where to go, what to do, big chains are probably safer because they've got rule books on their rule books about how the team of staff in that place are supposed to prepare the food.
I'm not sure about the nutritional content after you've soaked everything in bleach, but
sure,
anyway, that's a different point, isn't it?
Yeah, that's a different point, and that was the very point he was making, that it wouldn't be something that you would want to eat every day, but in a crisis that might be the safest place to eat from a food handling point of view.
Yeah, but at home, if you're washing everything, you wash your veggies and your fruit in the water first, and then you know that you've washed and dried all your equipment that you're using. That's how you're preparing everything else.
That's how you would make a salad, then that's fine how you would make a juice.
All right, well, I hope that helps you. Let's move on to this one.
My name's Anna. We are trying to have a baby, and we've just started, and I usually get regular periods all the time, and this time around, it's like, well, I've done 2 pregnancy tests now, and it's said negative on both of them. And I've had all sorts of tummy pains, but like I should be getting my period or that something's happening. And there's been a few times when I felt a bit sort of nauseous and hungry, and it's very uncommon for me. Well, not normal for me, because I'm normally on a 30-day cycle, and I got excited because I thought I was pregnant, but apparently I'm not. So I'm just wondering, is this normal? If I should be seeing a doctor about it just because it comes with the pain? How long should I wait? All these questions you have when you're trying to have a baby. Thank you.
I picked this one because she sounds so stressed, doesn't she?
Stressed and frustrated, that's right. And it can be difficult to understand your natural cycle at the best of times. And then to get the ducks in a row to have a baby, that poor person who's contacted us sounds a bit worn out by it all.
Yeah. And it's about staying the course, isn't it?
Absolutely. So let's unpack it a little bit. But what we all need to do when we're trying for a pregnancy is stay the course, exactly. Make sure, my model, we make sure we've got the ingredients right at the start. And then if we're sure we've got the ingredients right, then the last one is time. The urine pregnancy tests are very accurate. They're not, the standard one doesn't tell us how pregnant we are, it just says if we are or aren't and if there's presence of that hormone in the system. So whilst a false negative, if she might have been briefly pregnant and is no longer is possible, it's unlikely. Okay. If someone thinks they're dealing with a false negative and it's got a lot of pregnancy symptoms in a period that's late, but the P on a stick is saying negative, then getting a blood beta HCG level through local doctor can be a good idea. More commonly, though, the P on a stick is right. We're not pregnant. And we're going through a funny cycle, typically an anovulatory cycle where no egg was produced. And then it can be a long time until the period comes. And in any cycle, we can get strange symptoms like pain or nausea. Those things aren't necessarily confined to pregnancy. So normally what I would advise someone in this situation is to persevere, do some more urine pregnancy tests and a blood one if necessary. And if we've ruled out pregnancy and we're just having a funny cycle, long cycle, typically one where we haven't ovulated, the period will come. And women who've had this situation have typically had plenty of cycles like this before. Maybe not this caller, but usually. And they know that it'll come. And then when it comes, that's the new day one. We try again. And if we're having a strange cycle again, then it's time to investigate that.
So that's a trip to the GP?
Yeah, through a GP that is good in this area. And they'll organise some testing, perhaps pelvic ultrasound, perhaps a day 21 progesterone test to ensure ovulation. Because if people are having too many of these funny cycles, then it just reduces the number of rolls of the dice they get in 12 months to really have a fair chance of getting pregnant in the first place.
Can I just clarify, did you say if she has 2 funny cycles, then she would go to the GP?
Yeah, I think if someone's trying for a pregnancy and they've had 2, maybe 3 of these strange cycles, then they're going to be frustrated and want to get those cycles back on track.
How much do you think it is that somebody perhaps has had these funny cycles, like you said, in the past, but because they weren't waiting for a pregnancy or whatever, they didn't really note it?
They're easy to dismiss. Yeah. And I think if we take a careful history of somebody who is having anovulatory cycles when they're trying to conceive, they're probably not the first anovulatory cycles they've ever had. And if you go back through the years in the past, they'll say, oh, yeah, I did used to have that and I did used to have that. Yeah.
And can I further clarify? So if you've had an anovulatory cycle, does that often delay your period?
Yeah, sure. So remember, when we ovulate on day 14, the period will come 2 weeks later, and that's why the cycle's 28 days long. And if we ovulate regularly on day 20, then the cycle will be 34 days long and so forth. And at least that would be regular. And the regularity is the key more than length. If we don't ovulate at all, then there's a lack of progesterone secretion in the second half of the cycle, and the period may never come. It might come late. It might come very late, that's a hint that at least in that month the woman hasn't ovulated.
All right. Well, good luck, caller. I hope your period came first so you can set your cycle again at day 1.
New day 1, start again.
Yep, and that your next cycle produces a pregnancy. That'd be really great. All right, let's move on to this one.
Hey, Dr. Pat and Brigid. Thanks so much for your show. I bloody love it. I've got 2 questions for you, so I'll be quick. My partner and I are trying for a baby. I am 36, so I am just geriatric, and I know the recommendations is to try for 6 months before seeking any form of like medical assessment and things like that, going down the IVF route. So we've been trying for 8 months. I got pregnant on the 3rd month, but then had a chemical pregnancy. Then I was pregnant again on the 7th month, and then had a miscarriage at 10 weeks. So my question is, how long do we keep trying for before I get some sort of other testing done, perhaps? We do only want 1 child, so my thoughts are let's give it another crack for another 12 months and see how we go, but I'd love to know your thoughts. The second question is about semen. So sometimes when I'm ovulating, my partner and I don't feel like having intercourse, so he will ejaculate into a cup and then I will kind of turkey baster that into myself. I want to know, is that effective? And also, are there time constraints around that? Like, how long is the semen healthy for? And is that a safe thing to be doing? Awesome. Thank you so much. I can't wait to hear your answers.
Wow, she sounds like she could be a podcast host. A beautiful, clear voice.
Absolutely. Lovely, clear questions. Fantastic. So,
she's 36.
Yeah. So remember the rules about how long you're supposed to try for before getting help depend entirely on how old you are, both the woman and the man, and also the presence or absence of any of those red flags, such as highly irregular cycles, or significant pelvic pain, that mean that there might be a problem that needs to be sorted out first. Okay, so let's assume that they don't have those, that her partner is a healthy person with a presumed normal semen analysis, although I don't think that's been done. Then the next thing that I think about when I'm seeing a couple like this is how many babies do they want? Because that's highly instructive too as to how quickly we should move on the potential problem. And I always ask people how many babies do you want, and they always say I'd be grateful for 1. And I'm like, I don't mean how many would you be grateful for. I mean, how many do you want in your heart? How many did you want in your secret heart before you even set out to have family, perhaps even before you met your partner? Because that tells us what the real number is, and then we've got to calculate. Ideally, trying to have all of those babies, ideally before fertility really starts to significantly drop in our late 30s or by 40. What our call is telling us is that she's actually had a lot going on in the 8 months they've been trying. And she's been pregnant twice. And to have pregnancy losses on both those occasions is sad, and I'm sorry to hear it, especially the 10-week loss. Whilst those losses need to be honoured and respected, and a little recovery time taken to move on each time, there is actually one little shred of silver lining in that, and that is that she was able to become pregnant on both those occasions, which will help. I don't mind the problem. I don't mind the scenario for a couple like this to start a new 6-month trying period from the 10-week loss, and perhaps the semen analysis is likely to be normal, but that's an easy thing to check. The cycle length is likely to be normal because they've conceived twice in 6 months, in 8 months, and so we can actually guess at the result of a lot of the routine investigations. So I would be recommending trying again. Doubtless they'll be pregnant again soon, and what they'll want to do in the pregnancy is have an early scan. There's nothing quite like seeing that little fetal heart at 7 weeks when you've had a difficult run like this.
So she's already identified that she wants 1, and she said that she's willing just to keep trying for the next 12 months.
I like that plan. 12 sounds a little long to me. Maybe 6. it's nice for them that they only want one, but we still don't have any yet.
Yeah.
So I think in the overall circumstances, 6 would be plenty.
Yeah.
6 months would be plenty.
All right. And what about her, as she termed it, the turkey basting?
Oh, the self-insemination. Yeah, that's fine. Lots of babies have been born this way. It's not a terribly common thing, but it does happen, and the safety problem only applies to people using unscreened semen in this way, like from a stranger or from somebody they met online or what have you. There's an infectious disease risk there, which you don't have if you get your semen from a sperm bank where that's been tested for infectious diseases. So if it's your partner, this is okay. So the self-insemination, various self-insemination techniques are fine. When we do intrauterine insemination in a fertility setting, we put the semen right up there. But if you can get it up to the top of your vagina, that's where natural intercourse will deposit it. So that's okay. Monitoring the cycle to make sure it's in that right around that periovulatory time is not too difficult to do most of the time. And then as fresh as recently after it's ejaculated as possible.
And is she using just one of those syringes with the bulb on the bottom? But is that what people use?
Yeah.
Yeah. Good.
It's fine.
All right. Well, good luck. I hope call us. Call us again.
Yes, I want to know how this...
And tell us how
I
you
want to know
went.
how this pans out.
Yeah. Good. Let's move on to the next one, Patty.
Hi, Brigid and Dr. Pat. My name is Morgan, and you may remember me from your Q&A episodes 89 and 92, where we discuss prolapse after a traumatic vaginal delivery and which method of birth should I choose for any subsequent deliveries. Well, since episode 92, I did have 2 chemical pregnancies, but then I fell pregnant again with my November 2024 baby girl, who was delivered by the most positive C-section I could imagine, and you might be able to hear her in the background. But anyway, there was some discussion with my private OB at about 34 weeks, the vaginal delivery, which I had a bit of a bad reaction to unexpectedly mentally. So that was a surefire thing that we were going to book in a planned C-section. And it was amazing. The surgery for me and the recovery was really not daunting at all. It was really easy compared to my traumatic forceps delivery. And I know that's not the case for some women, but I'm just so thankful that I did ask you guys and I did get educated in regards to what happens in a C-section. So really, there's no question here. Just a massive thank you. Knowledge is power. You guys are great. Thank you for educating us all.
Wow. Brilliant.
There you go. Someone call back.
That's great. No question to answer. But that's brilliant, isn't it? That's somebody who set out to learn what the choices were, what their rights were in a certain situation, and did her very best to make the decision that was right for her. And man, it's a complicated question.
It is. It really is.
Yeah. If you ask 10 obstetricians, you get 10 answers.
Yeah.
Different answers, for sure. Some people say, the damage has all been done already by that first birth. And other people say, well, no, some of the damage has been done by that birth, but you could potentially create more. Someone would say the first birth is the hard one and the subsequent ones are likely to be easier. Well, yes, true on average. But ultimately, these discussions are not about what's happened to everybody else. It's about you and your pregnancy and what you want.
I like how she said that when she was in the obstetrician's office and they started to talk about how she was going to birth the baby, that she had a really big reaction to going through all of that again.
Yes.
And then she sort of listened to her body. You know, when people say, like, it's all listen to your gut and it's all instinctual, this is what instinct looks like.
Yeah.
A modern interpretation of your instinct.
Yeah, I always say to people that the right answer for you will bubble to the surface eventually. And people go, okay, well, we'll give it more time. And honestly, the answer comes. It comes.
That's all about having agency in your birth, isn't it?
Yeah, this is about agency. This is someone who has gone to the trouble of working out that she is actually entitled to have what she wants.
Yeah.
And then, of course, the tricky bit becomes, what do I want? Right.
Yeah.
That's life, isn't it? For a lot of us lucky to be living in a developed country and enough to eat and everything, then we tend to get what we want. The question is, what do we want? But this patient has said, well, I have now realised that I have quite a bit of choice, and then I'm going to set out and determine what that choice is, and then have the birth that I want.
Yeah, and also a planned cesarean. They can be really peaceful. They can be lovely. You have a lot of choice. I mean, you still get your patients to think about what it is in terms of a birth plan in a planned cesarean. Like, there's still things that you
can choose, absolutely. There's maternal assist, there's all of those things. But there's also, for some people, under some circumstances, despite its operating theatre location and the cut that needs to be made and so forth, for some people, under some circumstances, that is significantly less traumatic than what they've been through with a problematic vaginal birth.
Yeah. Congratulations, Morgan. I just loved hearing the little squeaks in the background.
We heard the squeaks in the background.
It was
beautiful.
Very cute. All right. Let's move to our, I think, last caller. Here we go, Patty.
Hi, Brigid and Dr. Pat. Thank you so much for your podcast. I really enjoy it. My name is Belinda. I have a 10-month-old and I'm currently 8 weeks pregnant with our second. This was a big surprise, as our first was IVF and this baby was a spontaneous conception. My 10-month-old is eating solids and is also breastfed on demand. My question is, should I be pumping to create a freezer stash for my 10-month-old just in case he refuses the boob when my milk turns to colostrum? I don't want to wean him before he's ready, and I would still love to offer him breast milk if possible. So any advice would be greatly appreciated. Thank you.
If this was visual, everyone would see us both sort of go, whoa. But that happened to us, didn't it?
Nearly that quick. Yeah.
Well, I think it was.
No, it was that.
Yeah, it was that quick.
It was quicker.
Hang on, I know, I was there.
It was quicker. Yeah. So, the question illustrates a number of points that we've covered elsewhere. But when you're breastfeeding, you've got some natural contraception. But if we're just down to on demand and mixed feeding, then it's not terribly effective. It's not effective enough for a lot of couples. But here we are. We're pregnant again. That's terrific news. It's certainly possible to conceive when you're breastfeeding, to breastfeed throughout the subsequent pregnancy, and to continue to feed both a toddler and a newborn. It can be done. Not everybody's up for it, but if our caller said, I'm not quite ready to stop, then I don't think you have too much to fear from the taste of the breast milk changing if it's got some colostrum in it the second time around. I'm not sure of the data on that, and we could ask our...
Yeah, we're going to get breastfeeding consultant coming on soon.
Yeah, we could ask our lactation consultant about that, but I don't think that's an issue, and I'm not aware of an older child rejecting it feed because the consistency of the breast milk changes when a new baby's coming. But, you could produce some and freeze it anyway, for example, so that there's plenty to give the older child when you're in hospital having a baby, or when you're exhausted from having a newborn and you're up enough feeding the newborn, let alone the demands of the other baby. But the question is going to be the supply. Do you have the supply necessary to do that? If you do, go for it. Yeah. It'll be super convenient. But I'm not aware in this sort of continuous feeding situation whether the taste changes significantly for them. I don't think so.
Yeah, and it's just magic, isn't it? Like the body knows to produce normal milk and colostrum, and it's.
I think you just keep going. Yeah. And so I think if you've got the energy for it, then go for it. Mm.
Yeah. Well, good luck. Congratulations. I found. For me, at probably about 10 months, it was hard to keep my supply up when I was pregnant with our fourth and feeding the 10-month-old. But it sounds like none of that is your problem. So
go for it.
Go for it. Love it. All right. Now, I also wanted to point out we get lots of questions about epidurals.
Oh, yeah.
And pain relief. And anyone who's interested in finding more in-depth information, I really encourage you to come into our program. I think in the birth module alone, there is something like 14 bundles. We go through each stage and sign of labour, pain relief options. We have an anaesthetist come in and talk about an epidural versus a spinal block, and for those very rare occasions where someone might need a general anaesthetic. So all of the pain relief ideas are explored within the program. So if this is you and you're really, really keen to find out more about birth in a hospital setting, I really encourage you to come into our program. So that's at growmybaby.com.au, and I worked out it's about $5 a week if you join at the start of your pregnancy.
Nice. We'd love to see you there.
Yeah, good. All right, everyone, that's it for our Q&A. I hope we got to yours. We've got tons to get through, but keep them coming because we love answering them. We love hearing your voices. It's really rewarding for us, as I hope it's engaging and educative to you guys.
Thanks for listening, everybody.
See you next week. Bye for now. Hey. Even though Dr. Pat is, well, a doctor, and we get lots of other doctors and other experts on our podcast, I just need to remind you that this podcast is for informational purposes only. We share lots of medical insights and experience, but everything we talk about is general in nature and may not apply to your specific situation. Please always consult with your own healthcare provider for your individual medical advice when you grow your baby.